the orthoPAC, hosted by Sam Dyer. Welcome to the orthoPAC, where we discuss up-to-date orthopedic topics for the busy clinician. I invite you to sit back and relax as I attempt to fill in the gaps between education, current events, and real-world practice. For today's special episode, I welcome Dr. Jennifer Orozco-Kolb. Jen is the Chief Medical Officer of the AAPA and the Senior Vice President for the Clinical Affairs Department at the AAPA. Another topic, there is some confusion out there with this.
Sure.
Optimal team practice. Can you talk a little bit about that and why we think it's such an important thing and a step forward as a profession? I'm just hoping you can share that with our listeners.
Yeah. Optimal team practice. So this is a term that our HOD, right? We have a House of Delegates made up of all 50 states, specialty orgs across the organization and our constituent organizations. And really, it's a term that the House of Delegates adopted to communicate what our long-term commitment is to modernizing healthcare laws. And this is really to ensure that all PAs, physicians, other healthcare professionals, that everybody has the ability to autonomously work together and provide their own quality care without administrative constraints. And, here's the thing, laws have not caught up with how healthcare has changed. We have laws on the books that are from the late 1960s and early 70s. They don't make sense anymore. And the only people suffering are patients. Period. The end. The way that medicine was structured back then is completely different from how it's structured now. And if we don't figure out how to modernize these practice laws, and this is at the state level and the federal level, right? Especially at the state level, PAs who have the expertise, the training, and the ability to take care of patients are not allowed to do so. And this is something that we can't afford in this country anymore. We have almost 70 plus million people without access to primary care, 130 million without access to mental health care. And that's just two areas. We have a growing population. We're going to have almost 81 million people by 2040 over the age of 65. How are we going to take care of them? This outdated hierarchy that we've created in medicine can be no longer. So it's patients who suffer, it's our communities who are suffering, and we need every single person. So whether you're a PA or you're a nurse or you're a physician or you're a respiratory therapy tech, whatever you are, we need you to have full autonomy and the ability to practice. So OTP itself, again, it's a term talking about modernizing PA practice laws. It eliminates all the legal requirements for a specific relationship between a PA and a physician or anyone else, frankly, for that matter, and allows PAs to practice to the fullest extent of their education, training, and experience. Period. The end. The other two components are really creating a separate PA board or adding PAs to the medical board. It just depends what your state, what the rules are. And allows PAs to be eligible for direct payment by all public and private insurers. So, are we really still haggling over payment? PAs are the only ones that don't receive direct payment in certain areas. We want to make sure that PAs who are qualified have the ability to do what they are trained to do. And these outdated administrative requirements, restrictions, and permission type of arrangements are just not okay anymore. If I know how to, I usually use this example. I was the only one in the middle of the night in the ICU. Patients were crashing. We were opening people's chests. There was no physician around. I was asking what to do next. I was the PA in the room doing that. And we have been doing that for 50 years. And so I have the ability in the middle of the night to take care of a crashing patient, but I don't have the ability to decide whether I can change a hypertensive med or a diabetic med. I got to ask permission. These are, again, non-common sense laws that don't make sense anymore. So that's what OTP is about. It's really about optimizing that clinical practice environment for patients because they are the ones who are going to benefit from this.
Perfect. And, I've been working basically in orthopedic walk-in urgent care for 13, 14 years. I call the doc if I need them. If I call them about everything, they're like, why are you calling me for this? I'm busy.
Right?
So, I mean, come on, So anyways, If you have any questions about OTP, there are resources on the AAPA website. I'd recommend you go there and look. All of this, we got some great information, a lot of positives, and now we're going into something that I'm very passionate about, and I will bite my tongue because I want to hear what you have to say. I put out several podcasts on this. I hope that people listen, and I was hoping you could talk a little bit about this scope creep campaign of the AMA and where AAPA stands, and what are some steps that our listeners listening to this, aside from educating themselves, what should they do? What can we do as a group to fight this?
Well, I'll say this, no matter what their motives are, the outcome is the same, maintaining status quo. And we can see where that's gotten us, right? And the reality is the status quo is not good enough for patients anymore. Patients are suffering. Let me be clear. This is not about physicians. This is about an organization that continues to talk about this so-called scope creep campaign, which is around not sharing truth and information, data, research, and outcomes that have been proven by PAs for 50 years and many other healthcare providers. And it's not just PAs. If you actually look into this so-called campaign, it really is about maintaining something that is outdated and doesn't benefit us anymore. The reality is we have a tremendous shortage of physicians in this country. I believe the last time I checked, almost 45% of physicians are going to be reaching retirement age. We can't produce enough physicians fast enough. We can't produce enough PAs and NPs fast enough to take care of everyone. And the physicians that I have worked with over the years and for many years are very collaborative, pro PA. And the AMA doesn't represent most physicians in this country. They just don't. And I know all of you and listening today work with tremendous physicians. We're not trying to be physicians. I think it's comical. People will say, "Oh, you're trying to be this or you're trying to be that." I said, "No, I'm not trying to be anything. I'm trying to be a PA and do what I was trained to do. And I have all this ability and expertise. And often am not allowed to do that. When we were allowed to do that? During COVID. And I was in charge of provider redeployment across the organization. And people who've heard me talk have heard me talk about this before. So I was in charge of all PA, NP, physician, and nurse redeployment across the system. That was my job, was to figure out how we were going to take care of everybody. And what the governors did by removing those restrictions was allowed us the ability to move people freely across specialties. And guess who was number one requested? PAs, because we have that training and expertise to move seamlessly. So I was taking my orthopedic folks and they were going in the ICU because they had the ability to do that and the training to do that. And so talking about changing specialties, we can't just be okay for healthcare when there's an emergency or a pandemic. You're either okay or you're not. So you can't shut it off and on. And why, if we just flipped a switch and said, allow PAs and everyone to practice, what would happen? Can you imagine what would happen in this country if we did that? And frankly, globally, not even in just this country, but what the impact we could have if we allowed folks to do this. We have proven outcomes, patient satisfaction. I mean, you can go on the AAPA website. It is just research after research after research. There's no argument here. There's no uptick in safety concerns. In fact, there was just a publication this summer around malpractice for PAs and how it actually showed that malpractice went down in areas that you actually allowed PAs to practice the way that they were. So we're not here to get into it and have an ongoing fight with them. But here's what I will say. The AAPA is going to continue to strongly advocate for modernizing practice. And we are going to advocate against any effort to add any barriers or restrictions to practice. And this is where we need that action. We need members, whether you're in orthopedics or some other specialty. This is why you join your state and your national organizations. This is why it's important to be part of AAPA. We're here to be your voice So we want to hear from you. So share, be part of it. What does this look like for us moving forward? I think we can really change and think about how we can do healthcare differently when we move forward, not backwards, and maintain status quo.
I think that's well said. Thank you so much for that. Listeners, if you haven't heard my podcast on this, I would like you to listen to those. I want you to listen to everything, but you really need to listen to these. I did a series of 3. One of the things that's most concerning to me, and let me back up. Absolutely. I love my doc. I mean,
Yeah.
we're buds, we've been working together for 20 years. Well, I'm not working with him as much anymore, but all of the docs in my group, respect them all, love them all. If you look at the AMA site, there are 2 contradictory things. One is prevent scope creep, and then they say prevent physician burnout. I mean, what in the
Yeah.
what I mean, you're we're
And
talking out of
promote
both
health
sides of your
equity.
mouth.
Right.
Yeah,
And
and
promote health equity, right? And remove disparities. You can't have it both ways.
listeners, you really need to educate yourself on this. One of the I'll leave this alone. One more thing. One of the things they talk about, you have to dive into some of their stuff. But the tenet that PAs can switch specialties, like you were talking about earlier, being able to go to
Yeah.
different things, that's one of the things that they are talking in the legislators' ears in the states, the federal level. Hey, we don't want that anymore. We don't want PAs to be able to do that. Guys, that's like 54% of you, according to the NCCPA, switch specialties at some point in your career. That's the reason why a lot of people become PAs. You need to know about that and you need to reach out and educate yourself because it's a big deal. All right,
Yeah.
I'll leave that alone now. Jen, what else can you share with our members about PA practice? This has been a great career choice for me. I wouldn't have
Sure.
done anything differently, and I'm so excited about our future. So please, let's end on a positive note here and tell people what they got to look forward to.
Yeah, the PA future is bright. There's so many changes that have occurred over my career. This ability to change specialties. I mean, I worked full time in vascular and then on the weekends did emergency medicine and internal medicine early in my career. And that was tremendously beneficial to expertise as I, grew as a clinician and where I am today. Over 40% of PAs are now in leadership positions. And here's one of the things that I will say I'm most proud of. When I first started, there was no such thing as a lead or even thought of someone, a PA, being chief medical officer or a medical director or CEO, whatever it is. And what I am so proud of now is that almost 40% of PAs are in some sort of leadership position. And I want to remind PAs, you have the ability to change healthcare. You have the expertise in all these settings, specialties, you name it. You are the one clinician that has the ability and the knowledge to make a difference in healthcare. So whether it's performance improvement, quality, population health, or administration and running healthcare systems as a clinician, you have that ability and use your voice and be there. I will say we were sort of trained back in the day to sort of be subservient in a way. And, there wasn't big roles for PAs in healthcare systems. And so, everybody just said, oh, I couldn't do that. I'll be a clinician and that's good enough. And I think what I want listeners and your listeners specifically is to realize that they can make tremendous changes in healthcare, especially in their communities at the local level. Change how we're doing it, think innovatively. You're the boots on the ground. You talk to the patients and see how patients are suffering. And so utilize your voice. I think a lot of times PAs aren't involved with advocacy or aren't involved in the AAPA or PAOS or what other organization, state chapter organization, because they think, it doesn't pertain to me. It does. Everybody pertains to you. Patients are suffering. So be there, show up, contribute to the organizations. If you don't like the advocacy route, there's plenty of other things you can do. You like to write op-eds, you want to do CME, you want to network, mentor, be a preceptor, whatever it is, get involved and inform yourself so you know what's going on. And we're just going to keep moving forward here for the good of patients. And I know that's what PAs want. And I know there's thousands and thousands of physicians, nurses, patients who want the same thing. So that's what we're going to do.
Beautiful. I'm so excited. It's a great time to be a PA. It's a great time to be practicing. Little road bumps here and there, but nothing we can't take care of. We're a big group of people and
Yeah.
dedicated clinicians. And Jen, thank you
Yep.
for coming on and discussing issues with us.
Of course. And have a truly happy National PA Week and just celebrate and be proud of who you are in the profession that you're in and where we've come. And I think we have a large group of young folks to mentor. And so use this PA Week to really elevate them and celebrate the physician associate profession. So excited about it.
Thanks, Jen. Jennifer Orozco-Kolb, the Chief Medical Officer of the AAPA, Interim Director of the PA Foundation, and a whole lot of other hats. Thank you for coming on and being our guest for our 200th episode.
All right. Thank you.